presentation is a few case studies to show. That's really where I think it meets a lot of different things. Some curiosity, and then we can talk. Okay, so how do you pick your patient's need? Dr. Marion goes into a number of companies that do it. I have been using one, and we'll talk about them. How biocompatible are materials you are using in your office to the general public? Do you have a test to test every patient for a specific situation? And how do you choose what to purchase, what to order from the dental laboratories or from suppliers? So we go ahead and the methodology, bioantigen testing. This is where you draw blood for all three of these. And what they do is you send the plasma in. Now we charge $25 for a draw, and then we send it out, and then we get the platelets back, and we'll go through that. EAV is electrical acupuncture by Vol, and that you learn at different things. If you want more information on that, go to Dawn Ewing. She's wonderful on that. So the three choices: Biocomp Laboratory in Colorado Springs. Blanche Gruby will be here earlier. She's the principal owner in that. And then there's Clifford Consulting, and they're in Colorado Springs. I've used them since 1994. And I've seen the test go from a booklet about this big to about 17,000 plus materials. They have the most complete listing of all of the products utilized. And then Melisa. I'm not familiar with Melisa, and I'll be asking Dr. Seward more questions about it, because quite often titanium comes up as compatible, even though I know it's not. And like she said, they're the only ones that have shown that it's not compatible, unless you take a Biocomp and they say all implants are not compatible. Because if you take some of these tests, there are some fine print on them, like Clifford testing will put down, if it's a known carcinogen or mercury, a poison, that product will automatically be listed as no good, even if the patient doesn't react to it. So you have a few things there. Okay, the pros: it's great documentation, total objectivity, reproducible, well, almost reproducible, because sometimes you'll put something in somebody's body and then they react afterwards. And once they reacted afterwards, then you find out, oh, it was compatible before, but not after. Clifford will give them a second free test. Additional income with the practice, well, we don't charge extra for that. And then the cons: that it costs money. Depending on the test, cost of draw blood, not 100% accurate. Okay, electrical acupuncture. You can test any material on the spot. Cost is effective once you get past the cost of the materials or product being used. Some devices have a printable record, and others source documents. The initial cost is bad. Operator sensitive. Some guys can't do anything with them. It doesn't work. Some devices do not have printouts. Questionable source of documentation if you ever put that in front of a board. So here's one, and this is something that they gave to me so I could go to the Philippines. The safety of dental materials has historically been assumed. Indeed, many materials have been classified by the FDA as non-significant risk devices. This testing is often superficial, with most interest directed toward physical performance of the material. When a biological response is considered, the reaction anticipated is usually acute toxicity. So, shaping a new thought. There's corrosion by products, outgassing, improper mixing, incomplete curing, dissimilarity in alloys, and diet and microbial presence. Shaping of the materials: you have discolorations and tattoos, mechanical site irritations, infection patterns, perio, tremor and motor problems, sweats and abnormal temperature excursions, numbness, tingling, asymmetric muscles and sensory control, increasing unexplained fatigue. Gastrointestinal problems, digestive problems, bowel dysfunction, persistent unusual taste sensations, sudden frequent urination, persistent headache and regional neurology, sleep pattern disturbances, itching, light, irritated skin. Upper torso, regional angina and chest pain, severe excursion of irritability and mold, and frequent non-focused depression, decreasing cognitive function, frequent severe tinnitus, frequent irritable fear, irrational fear, bruxing. Remember in my beginning lecture I talked about asking them to write a history of what has been done in the dental chair and materials? So that goes. And then it strengthens an antibody detection methods, so detectable even after toxic substance exists in the body, repeatable, demonstratable, classic laboratory methodology, irritant concentration independent, irritant source independent, findings have broad spectrum applicability, and specimen is storable when necessary. And so you have a qualitative findings only, no degree of reactivity data, cross reactions possible, false positives, false negatives, reduced value with universal reactors. Universal reactors are very, very frustrating, and they sometimes they are impossible to treat. You just can't find something that they're good with. Dr. Bybee. Okay, there are three questions here. Okay? First question, do I test all adults? About 98%. If I don't have to put something into a patient's mouth, more than just a composite filling or something, then that's the person I might not test because they don't have any problems or any symptoms. If I'm going to put an implant, a crown, or anything else, multiple restorations, I'm going to do a biocompatibility test. I will not place an implant on somebody unless I have that. Second question was, I use this test over 20 plus years to figure out what most people do well with. So that's what I mainly use. And I found Tetric Ceram to be very, very good. Tetric Ceram, Flow, Evo, that product line. But there's still 3 to 6% that can't take it. So I look for those 3 to 6%, and we have 3 or 4 different product lines. Let's face it, you can't just buy one carpal. You're going to spend $1,000 to have that type of material there. So I got another source or 3 that I keep in backup for that. Some people can't use Adper Prompt Del Pop, which is a etchant, and then once you hit it with a light, it's a adhesive. So that's 2 out of 3 of the questions. What's the third question? Very few. Very few. It will happen once every 4 or 5 years. I had a patient referred to me by a dentist who I didn't know, 2 communities over. She came in, and the guy called me, and he was all panicky and all crazy. So I said, okay, tell me the materials you used. So we went ahead, and I got a list of his materials, and everything he used she was reactive to. Now, he had done some of the most beautiful work I have ever seen on buccal composites. And I looked at her, I said, if I take all these out, I'm going to probably cause at least 3 root canals. So what I did was I called somebody who does allergy elimination techniques, who's in a homeopathic or naturopathic office. And he's a master of this. He's one of the developers after the original test came out. And he was able to reverse her allergies to the material. So then the patient came back to me, and she said, well, I want you to be my new dentist. I refused her as a patient. Her doctor had gotten on the phone with me and talked to me forever to make sure that he didn't do anything wrong. And according to the standard of care, he didn't. We have to maintain a standard of care. Ours happens to be a step higher, in my opinion. But good dentistry cannot be replaced with sloppy biological dentistry. It has to be done right. And we don't stab people in the back. I don't put down other doctors in front of a patient, with the exception of 3, which I will list off record. But, well, when you get patients from a different state coming in who's been treated by somebody who has 35 lawsuits going against them at one time, that concerns me. And I've met the gentleman. I won't say what our conversation was, but the whole thing is, it's important for us to make sure that if you're going to spend a lot of money in your office, don't you think it's worth the investment to make sure that for $300, if a guy's doing $10, $15, $30,000 worth of work, that you make sure you put something in that's compatible? I certainly think it's a great investment, even a crown. So, and there are other tests. If you talk to Dawn, she does EAV. But antibody reaction for entire chemical groups on one set of finding applicable to many products after the fact evaluations, integral source of independent and useful beyond simple dental material screening, patients with known material-related problems, immunocompromised people, auto-positive patients. You did say, you asked the third question was, what about the health of the patient? I think we do that for everybody. I think we have to classify them. Are they healthy, kind of healthy, not so healthy, and a disaster walking in? I usually get the not so healthy and the disasters walking in because they're so sick from what's been put in their mouth. So you have to be aware of what their status is. And then you got to decide, is that the person you really want to treat? Or is that the one you're going to refer to Margolis so he loses more hair on top of his head? We'll talk about that off record. Anyway, just remember that all metals have cations. Issues of content versus form, dissolubility, ionizability, binding to ligands, amino acids, proteins. So we want to know how reactive basically everything is. The debate that between the two laboratories was basically there's a difference between aluminum and aluminum oxide. I personally would not place a zirconium piece of metal in someone's mouth. Now, zirconium oxide is a totally different product. And there are differences in the zirconium oxide implants on the market today, how they're processed. I happen to do Z systems because of the technology and the money that they've reinvested into it. They're smaller. Stratum, the largest maker of all implants, has now come out with their own zirconium oxide implant. And it's a pretty darn good one, too. So it goes, these guys are starting to wake up. Yeah, they are processed differently. So anyway, aluminum restorations, there you go. Forms found in glass and sand. Human skeleton has aluminum silicate, normally natural and routinely. Sometimes disguised as a quartz, mica, and feldspar. The soluble aluminum is a grave cause for concern. So be careful. Even when you go to restaurants, when they have aluminum metal pans, those aren't healthy. That's going to disseminate into your food. How do you know? You don't. So you have quantitative findings, no degree of reactivity data, cross reactions, false positives. How did we get there again? I don't know. Came twice. So this is what they do. They have a test tray. They take your plasma, and in each one of these little components there, in those little tiny components, they can place the reactant filter things here, and it goes into a computer. There's Jared. That's another Clifford. And they come to the computer, and then they send it out. I think they went to U.S. mail. I'm not sure. But bisphenol A and certain other organic compounds can mimic the binding qualities and stimulatory functions of estrogen and may be carcinogenic. Uncured or incompletely cured monomer may be an issue. So when they tell you put that light on for 20 seconds, put it on for 20 seconds. 5 seconds doesn't work. So do not take shortcuts. Calling this is next to godliness. It's like when guys are making airplanes, and they were trying to produce airplanes for the military in World War II. Some of the guys figured out if you just did every other screw and put it in, you got done quicker. Would you want to be riding on that plane? Not very much. Nickel is a wonderful structural steel in certain stainless steel applications, but keep it out of the body. Chromium in penta or hexavalent state is a disaster. Cadmium, it will do anything mercury will do, arsenic and lead. It's just a little slower. Hiding metal alloyed under porcelain or ceramic is about as isolating as coating mercury with saliva. Never, never, never use mercury and gold in the same mouth. Blood antigen testing utilizes plasma from your blood. They test now, I think it's almost up to 18,000. 2 other blood tests, again, I gave you those. So I just wanted to thank them. EAV is also a good way of doing it. I wanted to thank Clifford for giving me those slides to help me out. This is what a Clifford test looks like. This over here is the good, the name of the patient. This is the bad stuff, not so ugly. And there's a cheat sheet. These are products that we use a lot of. And so when you look at the bad, these are the groups that usually are reactive. The ones over here with the asterisk are carcinogenic or just pure poison. And then that's the bad. This is the this is the good stuff, the things that go there, and these are the things that I use in my office. And so what we found reacts the most is going to be IRM, biodentine, which is a beautiful product. If you ever have a pinpoint exposure to a tooth, pinpoint where it just barely bleeds, you can actually take biodentine and place it over there and watch it. And it's 98% compatible to the people that they've used it on. So rarely we'll get that. Those are the Tetrix. And you'll notice those are the manufacturers on the side and everything else. So table of contents, you can go through, and this is what we find a lot of. This just happens to be metals. NS is not suited well. S may be suited. Probably haven't been exposed to that one yet. But I find a lot of these. And it just goes on. We can make the correct choice for the patient at this time and place. Remember, a patient can have future reaction to a new product. Now they have been exposed. The patient can become reactive. So acupuncture, I'm not an expert or anything near that. So you need to decide. Is dentistry toxic? Will you protect you, your patient, your staff, and yourself? And that's when you were supposed to do your lecture, but I thought it was better for taking a little break. So how does the individual teeth affect somebody? This is the tooth of the matter. You have enamel, you got dentin, and you got the pulp, which contains lymphatics, nerves, and blood supply. Then you got the periodontal membrane, or what we call the periodontal ligament. So the tooth consists of 3.5 miles. We've got dental tubules. We've got the temperature 100 degrees. It's very dark and moist. This is held. Now this part of my presentation is what I talk to my patients with. I actually sit down, I have a consultation room, and I go over teeth. And this is what I tell them. And part of this has already been discussed. PDL, periodontal ligament, peri-round dental tooth, ligament holds bone to bone. So the purpose of a periodontal ligament is to hold tooth to the jawbone. It acts as a cushion. When you bite down, it goes in. When you release, it comes up. It's a plunger. And then it gives you feeling without pain. Just try it. It shouldn't hurt, but this is the killer. It prevents bone growth. Every ligament in your body prevents bone growth, correct? Ask a chiropractor, ask a physician. That's supposed to stop the bones from ankylosing, coming together. So, What affects the periodontal ligament? The materials, how they're handled, has the doctor tested for biocompatibility, are the procedures being performed correctly, and no epinephrine in the anesthetic. See, I don't have to explain any of these things. We've already gone through them. So, when we sit there, let's examine two different procedures of what we do. Extractions and root canal therapy, if you even do that anymore. Extractions. When a tooth is extracted, the periodontal ligament remains in the tooth socket or comes out with the tooth. The remaining periodontal ligament within the socket prevents bone growth. That's the purpose of a periodontal ligament. It creates an environment for bacteria, protozoans, and viruses to live, and heavy metals and pesticides to settle. I can actually show this in a DNA test. I can't do this anymore because that toxicity test from ALT by Dr. Boyd Haley is no longer available. So I can't do that. But when we extract, what do we do or not do makes a difference in our patients' lives. To prevent infection or toxic conditions from developing, the biological dentist surgically removes 1 to 2 millimeters of bone within the tooth socket, which removes the periodontal ligament from the jaw. Gives you better healing. It's less post-traumatic pain, prevents dry sockets, and decreases the possibility of developing ischemic, lack of oxygen, osteonecrosis, dead bone. So I talk about the Steinman stuff and everything else and how everything flowed through. We went through that thoroughly. And the root canal tooth is dead. Root canal therapy is performed when the nerve has been exposed by trauma, carious lesions, a cavity, or unexplained death. Blood vessels, lymphatics, and nerves to the organ, because a tooth is an organ. I actually had a fight with a physician about that. She told me teeth aren't organs. I sat there, I said, it's a piano of organs, but it's organs because it has a function, has its own nerve system, and it has its own lymphatics and blood system. That's the definition of an organ. Blood vessels, lymphatics, and nerves to the organ are removed. Materials placed inside. Consequently, the protein that existed inside the dental tubules of the tooth prior to the root canal therapy will decompose, and toxins are forced into the periodontal ligament. By the way, if you ever decided you wanted to use this, I ask that you may use every slide I've got on my presentation. Just please give me credit for what I've done. Opening the tooth to expose the pulp and canals, access is made to the center of the tooth. You shape them, you put a liquid paste, got a perch or something in there, and now the tooth's dead. There's no hydrostatic pressure from within, keeping the bacterium, protozoans, and viruses from entering the dental tubules and feeding upon the dying and necrotic proteins left behind when the tooth is alive. The treatment has destroyed the natural pathways for the tooth to be nourished. Waste disposal pathways no longer exist. Therefore, the necrotic tissue, as you bite and release and go up and down, is being oozed out into the periodontal ligament. So, now the protein that was in the dental tubules are trapped, no nutrition can enter, no waste can be disposed of properly, in my opinion. All root canals are time bombs. So I believe there should be extraction of tooth, complete debridement of the socket, surrounding bone. Now, this is the fun part. A year and a half ago, almost 2 years ago, I spoke at the International Academy of Ozone Therapy, Frank Schallenberg's organization. It's really a good one. And I gave a presentation similar to this. And a group of guys who do ozone treatments who say that you can ozonate a root canal and it's going to be a safe root canal, I disagree with. Now, the good part about it is in an organization we can express different opinions and state, okay, this is good or this is bad, or we like this, we like that. And so after my presentation, one of the founders of that group, who was an instructor of mine at Capital University, and I have a lot of respect for these guys, I love them dearly, and I believe in ozone therapy. I've seen teeth that started abscessing, and you do what these guys are teaching you, you can prevent the abscess from developing, and you can actually restore health to the area. And there's a lot of good things that they teach. But when it comes to this, dead is dead. There's still no pressure coming out. And you cannot stop the stuff from going in. And you cannot clear out 30-micron tubules. You might be able to clear some of it out with the ozone. I'm not going to say you can't. but there's still healthy tissue left in that tooth after you remove it, so it shouldn't have an effect with the ozone when you're first treating it. It will still become dangerous or reactive something like 18 to 24, 36 months later. It's just as toxic as before. Vince? Yes. I'm going to do that. I'm getting there. Trying to keep moving. So we'll talk about that. And I got to update my stuff, and I'll tell you about that. Yes. Yeah, no question. Everybody hear that? Okay, she says she's taken out teeth that have died from trauma, and they have just as much bacteria and crud in it too. So, I don't believe in that, and here's what is ischemic bone. Literally dead bone from poor blood flow. It may either have either dead bone or bone marrow that has slowly strangulated or nutrient starved. It may occur naturally when third molar eruption occurs, result from poor surgical techniques taught in dental schools worldwide due to nutritional deficiencies, poor blood circulation, or heavy metal poisoning. And depending on the location of the tooth, you'll have different health problems. And so this, I want to thank Dr. Jerry Boco. He just retired as an oral pathologist, and he was just hired by the University of West Virginia, where he was chairman of that department for 17 years. Then went to the University of Texas in Houston, was there for 12 or 15 years, and just retired. And then he got rehired by West Virginia. They're looking for an oral pathologist. This is a gentleman who had all his teeth pulled. Every tooth was removed with epinephrine. They didn't heal properly. He started getting pain, and if he tried to wear a denture, well, it didn't work, because here's the mandibular nerve, and if you look closely, you'll see black around it. The myelin sheath was gone. It was dead, no longer insulating that nerve. So it was like taking an ice pick and just stabbing the jaw. So he took a bullet, put it through his head, wrote a letter to his family telling him he was sorry, he couldn't take the pain anymore. I donate my jaw to Jerry Boco. And Jerry did the biopsies post-mortem and found that all this was what he called NICO, neuralgia-induced cavitational osteonecrosis. This is what he was seeing with a lot of patients. It could be abrupt or it could be gradual. So, neuralgia-induced cavitational osteonecrosis, or myelitis, is pain caused by a hole in the bone of dead or an active infection within the bone. Pain is of the face, head, joints, and muscles, may appear as arthritis, fibromyalgia, chronic fatigue, or many different degenerative or unexplained diseases. Now, I see a lot of patients referred to me with cancer. I can't write down cancer on this slide, or I'll be run out of town. But I've seen people get all this garbage out, get all the metals out and everything else, and I got some cases to show, that their cancer is reversed or stopped because of the treatment that they had. Going to go beyond this. Those are the areas in the jawbone that you have poor circulation. And Jerry came up with 72 diagnostic names for the same disease. All it depended upon was where was it in the body and who discovered it. In the jawbone, we see chronic osteitis, was G.V. Black's name. Radner cyst, Roberts cyst, guess who named that after themselves. Cavitation, ischemic osteonecrosis, NICO, you name it. There are a lot of names for the same disease. Histologically, they're all the same. Very similar between the jaw and the hip. When Dr. Boco finished oral pathology, he did a general pathology at Mayo Clinic. And he was doing hips, and he saw that they were identical. So he made up a number of slides that he gave to his mentors. And he said, what is this? And they all said hip. And there was only one sample of a hip ischemic bone. All the rest were of the jaw. They were unaware that this is whatever occurred. So one part of the body affects the other part of the body. Traditional dentistry medicine confirmed this, that when a patient has a heart condition, kidney problems, artificial joints, or other conditions that may affect their overall health, that dentists will pre-medicate prior to invasive dentistry. What's invasive dentistry? A cleaning, anything that draws blood. So, a source of infection may become a health interruption in different parts of the body. Materials in our mouth may affect the lining of the gastrointestinal tract, muscles, joints, and other parts of the body. Remaining periodontal ligament may interfere in a person's energy flow along the body's 5 acupuncture meridians. And then impacted wisdom teeth, oh my gosh. I've had people come on in, either with impacted wisdom teeth, well, myself, my blood pressure was a low 210 over 160. I know what's in blood pressure medicine. I won't take it. So what I would do daily is I would go in and give myself a little tiny injection at the 3rd molar area back here, and my blood pressure was 145 over 80. So through a diagnostic test, I found out what was causing my high blood pressure. I went to a guy by the name of Wes Shanklin. Anybody know him? I love Wes. He's out of Ohio. He's gone through heck and back. He cleaned that out. 3 months later, my blood pressure is 120 over 70. Unless I walked into my office. It always goes higher when I'm working. But the whole fact of the matter is the 3rd molar will affect your blood pressure. Now, I've had patients where we've cleaned all those out, and they want to go off their blood pressure medication. I am not authorized to do that. I can't tell them to do that. So I tell them go back to their physician and get permission. So go from there. So, which tooth is related to what part of your body? Okay, click on Tooth Meridian Chart, and click on the Tooth Meridian Chart, and you'll find out that there are 5 meridians: urogenital, liver, gallbladder, large intestine, lungs, stomach, thyroid, heart, small intestine. And this is what is kind of funny. I think, you smile, you attract, I used to say opposite sex, but you attract somebody. And then you got your gonads, intestines, kidney, bladder, adrenal glands. I'll tell you something. If you see a root canal on 7, 10, 23, or 6, or what you'd say in the European, the 2s charting, you're going to have chronic fatigue. It's not if you're going to have it, it's just when are you going to get it. That is for certain. And then this chart, which you'll get at the end, I'll tell you how to get it. I think Dory's here, they sell that. And it just tells you the relationship between all the organs and everything else. Here's liver, gallbladder, major detox. You can go through here and you'll get all the organs and stuff. And then over there, you have the large intestine, lungs. It's the upper premolars, lower molars, and also your thymus. Thymus is kind of important because it produces T cells and prevents you from getting sick. It's the education where they take the organism in and make your body's defenses. And then you go on to my experience. How did I become a biological dentist? One of the reasons was a little girl who I put a mercury filling in, and tooth number 12, and her eye twitched for a long time. And then they came back after $2,000 spending with different doctors to figure out what was wrong, and I took it out and put an IRM in, and within 30 seconds, her eye quit twitching. Her father, who worked for General Dynamics or someplace like that, said, oh, let's do an experiment. Let's put another mercury filling in. I never put another mercury filling in a human being since. But that's how I found out about it. But this was me. I got rear-ended by a tow truck going 45 miles an hour while sitting at a stoplight. And I had a root canal on tooth number 3. Within 5 days, my neck was 24 inches from 17 and a half inches. If I ate anything, I had gas so bad I had to leave a room. It was painful. 2 months later, I had kidney stones. And then I had kidney stones again the second month. So I had those taken out. When I ask women if they have a root canal on one side of their body, I'll ask them if they have more fibromas on the right breast compared to the left breast, or vice versa, depending upon the location of the root canals. And usually the answer is yes. So I think it's a factor to be considered in breast cancer. So if you go through here, you'll see there's the pancreas. I can thank the doctor who came up with the diagnosis that I had thyroid cancer. That was 6 months later. They took my thyroid out to find out it was totally healthy, and now I'm a diabetic. So that's a lifelong struggle, and that's how I became a biological dentist, because I had this card in the mail. My twin sister called me up and said I should go see this biological group, and a patient came in and said, "Did you see this conference?" It was in Carmel. 1995, I believe, 1995, and I met wonderful people. I met Ed Arana, who unfortunately by then had had a stroke, Chris Husser, Dietrich Kleinhardt, Dawn Ewing, Bill Glaros, Terry Lee, people who were my mentors and how everything was and how it went. Then I met another group called, I think they're called IOMT. Yeah, I can't list all the people, but Rich Fisher especially. I could go on and on of people in both groups of how I learn, and I learn every day things from them. So you just go through the chart and you look at that. And then we get to the wisdom teeth. Are they really wise or not? You have high blood pressure, you have heart problems, but this is the kicker. It's your small intestine. The duodenum jejunum ingests, it absorbs trace minerals and vitamins. Your neurological system, your organs are not going to function unless that is healthy. So you go through those, and then this is how you can get it. The Tooth Meridian, or the meridiantoothchart.com. They have an 888 number. No, it's not pornographic. It's just 888. Okay? And you should be able to get that. Dory will have you met Dory earlier. She handles our continuing education stuff. She's wonderful. It's great. Okay. Everybody got that? Who needs it? All right. So diagnosing care can be difficult. You do nothing. I'm lucky. I got a 3D cone beam. I really think that those are important. EAV testing is very, very accurate, by the way, if done in the right hands. Cavitat, you can't get anymore because it's not on the market. They're difficult to find. There is a new ultrasonic machine that will be coming out of Germany. We're hoping within 12 months. And then a diagnostic or trigger point injections, applied kinesiology, or what my wife says, woo-woo. And then homeopathic remedies, oxygen. Hyperbarometric oxygen is great. Ozone therapy is wonderful. But in my personal belief, surgical excision of the affected area or extraction of the tooth seen in the 3D cone beam, radiographs, and confirmed with either EAV, cavitat, or applied kinesiology. Diagnosing can be difficult. You can do nothing. And there you go, again, double slide. So I don't have a 3D readily available on this one. I left that at home. I apologize. But they're adjustable. And what you do with this to diagnose if something could be affecting a foot, an arm, a leg, what you have here, you can use sterile water. I use Polocaine 3%, no epinephrine. And you go around the mouth and feel in the mouth in the buccal mucal fold. With the tip of your finger, you'll press. Once a tender point is found, take a needle or a sharp-pointed object and drag it in the buccal mucal fold, down in here or up above, and a small bleeding point will appear. At that point, I will insert a needle about 1 millimeter and deposit only 1 to 2 drops of liquid. Now, Dietrich Kleinhardt taught me how to do this, and in his best German accent, he says, "I know you Americans love to give more. Less is better." So I can't do it as well as he can. So you do multiple sites. You go 2 millimeters. Why? Because you don't want a lot in there, but you want to make sure you hit the acupuncture points. The trigger point injections may identify teeth that could be causing pain or an area of the mouth, but are not showing pain clinically. So these teeth could feel fine. So you got to know your tooth chart to see what areas are going, because you might not elicit pain. But my son was competing in Taekwondo, and he pulled a muscle in his left leg. He couldn't only move it that far. So I went down to the lower canine, because that's your lower extremities. I gave him 3 injections, and he took his foot from 1 inch off the ground to over his head with no pain in 30 seconds. So it's just acupuncture in the mouth. You can't leave a needle there. So you can relieve pain and other things from people. And you can find the source of it, if it's a tooth. The 18 different points around the retromolar pad on all arches can help you with TMJ. Had a young lady come in, actually two young ladies. One is a professional stretcher. They do football players and everything else. She's a little tiny thing. Could not open her mouth. I gave her one treatment 12 years ago, and she's fine. Betty, who is a naturopathic physician who was doing a residency at the Southwest College of Naturopathic Medicine 4 or 5 miles from my office, came in. She hadn't eaten a sandwich since she had her wisdom teeth taken out. I gave her injections in 4 areas, and she went from 23 or 4 millimeters to 45, 50 millimeters, and left class and went and ate a sandwich for the first time in that length of time. She was 28 years old. So this can help people out. Gentle placement, deposit only 1 or 2 drops, and just take a look at where you're going. Know your meridians, inject the affected side, examine the dorsal surface of the tongue. What can you tell me about this patient with their tongue? Anybody see anything strange? Heart, okay? Right here is the heart, okay? Tip. If that's red, that's dangerous. If it's bright, bright red, it's dangerous. This groove down the middle, digestive problems. Over here, see the scalloping of the tongue? That person's a sleep apneic. When they're sleeping, their tongue is throwing back into their throat. They can't breathe. So they're like a weightlifter, clenching their teeth. You can't see the flatness of the teeth in this picture. And they're pushing their tongue forward, trying to get oxygen. So you drag the needle, you look for bleeding points, you add a little in there, only a few drops. Same thing here. Now, had a young lady come in, and her husband, she met playing softball. This is not him. He had this tooth knocked out, the canine knocked out, root canal, root canal, root canal, and the worst bridge I ever saw in my entire life. They were married from softball. They got married, and for 18 months they had a wonderful life, and then the poor guy couldn't get an erection. And a naturopath sent him to me. What's the problem? So I did the exam and everything else, and I did these injections. They live about 2 hours from my office, and the next morning I get a phone call, and I got the message, and John said, my wife would like to tell you something. And she got the phone, and she goes, whoopee! He didn't come back to me. I was too expensive. And he went to a dentist locally and said, I want these teeth out. The guy said, they're fine. He says, no, I need them out, and this is how I want you to do it. Because in Chapter 24, Root Canal Cover-Up, it tells you exactly how to pull a tooth. So please get that book, Root Canal Cover-Up by George Meinig, who I met at the IABDM. Amazing man who started root canals back in the 1930s. He had 5 root canals and was very, very sick. He was 60-plus years old. He had already gotten into nutrition, and Chris Hustler came in, and he was on his deathbed. He says, get rid of the root canals, you'll be fine. And he says, young man, I started root canals. They're perfectly fine. The next day, Chris came by. He was on staff at this hospital. He says, how you doing today? He says, I'm going to prove you wrong. You're going to take my root canals out, and I'm still going to be sick. Within 2 weeks, the man was out of the hospital, no condition, none of the problems that he had, everything was fine. And he got Western Price original volumes were given to him, and he wrote the book Root Canal Cover-Up as a result of that. He lived till he was late 80s, 90s, 90-something. Yeah, he was an amazing man. So he regrets what he did, but that's what happened. So maxillary area, if you want resources on all these things, Janet Travell's Myofascial Pain and Dysfunction Trigger Point Manual is not just of the mouth, but the whole body. Good luck finding this book. This was my father's book. And Harry Shapiro showed the anatomy of head and neck and the effects of what teeth had on other people. And then Peter Dosch, it was finally translated into English, Manual of Neurotherapy according to Hunique. So nuts and bolts, clinical applications, all truths passed through these wonderful steps. So I'm going to do 2 surgery systems. These are much older. I am not as aggressive as I was back then, and I have much better techniques. But this is a young man that was sent to me by Steve Swidler up in, or down in Tucson. I'm up in Phoenix. And this man was having a reaction to this monstrosity. It is a titanium implant. We did a cavitat on the lower left because he was having symptoms. Let me go back. You can't see it too well in this light. This tooth was having a problem. So anyway, this is what a cavitat does. It tells you if the bone is solid or if there's holes in the bone, porous. 19 and 17 clearly show that it is not any of the others. And so we combine this. Now the crown is off, and you can see that the implant is gone. So this correlates here, this correlates there, and then this is 18, 20 through 24. So we measured that, and on a cavitat grade, a 0 are these. This is a 1 or 2. Then you got a 4 and a 4. 4 is bad. So we go ahead, we look at the site, and there's the tooth broken off. We're saying hi to it. And be careful not to cut the mental nerve while retracting the tissue, because the mental nerve is someplace down here. That will get patients very, very upset. Come on. So today what I would do is I would split that tooth in half, because now I'm doing implants. I really respect that cortical bone. And I'll take each root separately, and then I would send this off to head and neck evaluation. Now I'm sending it to West Virginia because that's where Dr. Boco is. And obtaining the biopsy samples. What you can see is in here, I don't know how well you can see it because of the light, but there's abscess. So I was working around the abscess, and then I come in. This is a east-west, I believe, and then I scoop out and collect this. Today I send that to DNA, but since board members don't understand what a DNA sample is, we'll probably have to go back to the old-fashioned way. I'd like to do both, and I'm going to talk to both my labs and see if I can get a deal from both of them to cut the cost down a little. But you just scoop this stuff out and send it to a lab for biopsy. And then when you start looking at the third molar area here, you have to realize the location of where that tooth is. Third molars are always buccal to the second molars on the lower. It's a question of how buccal. And that's what a 3D cone beam will show you. This is here, the tooth is way out there. And so that gives you a little perspective. I'll tell you how to cheat and find it. When you raise your flap and you move the tissue over, get bare bone. Sit back, have a cigarette, a drink, or whatever you want, and then you'll see bleeding points come up. God gave us a roadmap. Connect the dots. You don't have to connect the outer dots, but connect the dots and lift it up, and you will be in the center of the lesion. You'll be right above it. Happens 99% of the time. Now, with a 3D cone beam, you can measure the location of the nerve, how deep you can go, and where it is widthwise. So I strongly suggest that you have a 3D and you outline it. because a number of them I found are 4 millimeters deep. Why? Because when they extracted the tooth, it pulled the nerve up. And if you do your normal entrance, you're going to cut that thing in half. So now I refuse to do the surgery unless I have my own 3D cone beam doing it. They're a little expensive, but it's worth saving a lawsuit. So, come on. So now you can see the relationship of the two. You obtain your biopsies. With DNA, you're going to use blood also. And there it is. This guy was really cool. I don't know, we didn't show a number 10 round burr is what I usually clean these out with. And I use a feather stroke. I don't grind and go deep into it. I take it to the bottom, feel how deep I am, lift it up a little, and very carefully go around and up with that. Now, if I'm in a third molar, taking out an impacted third molar, I'm going to stay away from the bottom 1/3 because many times I'm just sitting there looking at an exposed nerve. So I don't want to start cutting there. Do you get bleeders? Yes. It's pretty cool. You're sitting there, all of a sudden this thing goes right by you. Oh, incoming, duck. But that's common. My son's an oral surgeon. Board certified, just got it last year. Great kid, love him to death. When my mother was alive, she had 2 root canals on her lower left, and it was hurting her, and she came out because she got free dental. And then my son happened to be in town. He was a second-year oral surgery guy. He says, Dad, I always wanted to see what this is like. So he sat down in the assistant chair, and he's also left-handed. I'm right-handed. So we got her numb, and we reflected everything. And then I said, look at these bleeding points. I want you to remember the bleeding points. Then we took out the root canals, and we were packing those up for biopsies. And my mom, before we got started, yelled out, stop. I looked at her. I said, what's wrong? She says, I'm going to savor this moment. I've got my son on one side, my grandson on the other, and I'm the center of attraction. What more could a Jewish mother want? So we went through that, and I opened up the back area, and I gave him a spoon. I said, clean it out, after I took the first sample. And it took him 5 minutes. Now, this guy puts jaws back together. He takes cancer stuff out. I mean, it's amazing what oral surgeons are trained to do. I couldn't ever hold a candle to them. But to this, all they would have to do is take a little extra time and clean, and we wouldn't have to do any of this stuff. So we went through. After 5 minutes, I finally looked at him. I said, are you done yet? He handed it back to me. He says, I know you, Dad. Okay, what did I miss? And so I opened up the lesion more, and I cleaned it out. You should be able to look almost directly into the whole thing. You're not going to break a jaw unless you already know that it's a problem, and you're not going to go into it. So from here, there's the sites in a mirror, so it's backwards. And then these are the samples we got. Okay, now back here, I'm sorry, this is not the sample. This is when I was doing cadaver bone in there. I mixed the blood and go with that. Today I use Steiner paste and PRF. In the PRF, you draw the blood, you spin it, you take the plasma, and you can, after it's spun, it comes out as a glob. You can compress it, or you can take the whole thing and just place it in. That's the patient's own immune system. You can't go wrong with that. And when you're taking a beta-tricalcium phosphate that's going to grow the patient's own bone, it's what's better than your own bone. And then you get a nutcase that walks in and tells you that they're allergic to what you put in there. Oh, you're allergic to your own bone. Because that beta-tricalcium phosphate is gone after 8 to 10 weeks. It's no longer there. It's nowhere to be found. So anyway, you get this, you pack it in, and then I suture tightly. Now, sometimes when you take out a tooth, you don't get the pleasure of having enough tissue. So I'll lay the membrane that's been squished across here. I'll suture it to one side. I'll place the Steiner in, and then I'll bring it over and I'll suture it to the other side and then go back and forth and cover it. And that's what I have to update my slides for. Case 2. This was one of the 8 patients that I did for my dissertation at Capital University. And what I did was basically tried to prove the Cavitat didn't work. And this is the long name, very impressive. Accurate detection of jawbone lesions and osteolytic abnormalities using the Cavitat ultrasonic imaging system, a clinical study utilizing photo affinity labeling, which was Boyd Haley, and histological assessment, which was Dr. Bocaux. And I did this study. It cost me about, $20,000, $25,000. My son, who's a PhD, the other son, who's an orthopedic surgeon, said in a university this would have cost $150,000. In private practice, we can do it for a lot less, but we don't get supplemented for our time, money, and efforts. But it was worth it. Take a look at this. Up here, we'll go back. Okay. Right here, 1 and 2. 2 was a root canal. The third molars were the rest. Pretty much pretty good. This one could have some overlap, but I don't think so. I think the tooth was dead. So anyway, we go through here. There's your root canal. So from here to here, here to there, all the rest are pretty good. This is sinus. So sometimes you'll pick up the sinus. So a Cavitat is no good unless you have a pano. You can't do individual x-rays. You have to have a pano. And then here's the histology report. Osteoporotic bone with ischemic bone marrow damage is consistent with regional ischemic osteoporosis, a variant of ischemic osteonecrosis, maxillary right tuberosity. And then on the other side, here we go. We've got which tooth number? It's tooth 31. Okay, that's the lower. Another report, osteoporotic bone with ischemic bone damage, consistent with chronic inflammation of marrow and with intravascular thrombi, mandibular right second molar. Okay? Intravascular clots here might indicate hypercoagulation state. What does hypercoagulation cause? What could be a result of it? Did I hear stroke? Another little tidbit for you to look at. Look at a patient's ear. Look at their earlobe. Now, if women have them pierced and they wear earrings, they're going to go down to their shoulders, okay? Forget it. That doesn't count. But if you see a guy who doesn't have an earring, okay, and you see a groove going down there, that is a sign of somebody with cardiovascular problems. It's an endocrinological diagnosis. And you talk to them about it, and you take a real good look at those third molar areas. Okay? So, this is what ALT used to do. Look at the colors. Look familiar to a Cavitat? They went through, and we found that if you go to these locations on a ATP production at a cellular level, you would find that a percentage of inhibition was done. And I'm not an expert at this, but what Boyd Haley did was he put radioisotopes on every one of these enzymes. And he took a sample and he did electrothesis through and brought it through, and he collected what made it through. What didn't make it through was the percentage of toxicity. So sample 31, we did both. In fact, in this case, I did both the ALT and the histology. ALT had to go first for toxicity. So then what we found in the area of 32, partially non-viable bone with ischemic bone damage, consistent with bone marrow edema. Subacute osteomyelitis, so there was a little infection cells in there and everything else. So basically, it's unhealthy. And the reason for that is the periodontal ligament prevents things from going. So you got to just go till you get to nice, solid, angelical white bone. And so again, in this location, this is tooth number 32. Look at the toxicity level, all 5s. So we scanned 8 patients, 256 sites were done. We had 193 healthy sites, 63 unhealthy sites, 75, 25. There were 6 of us that did this, that submitted for 1,300 biopsies. I put in over 450 biopsies out of that. And then what we found in our group was this split. We found that we had a 40% in the molars. Everything reflected. We didn't get too many canines, so it was less than 1%. But look, your first molars, second molars, and third molars. So your retromolar areas had a large majority of this. And then what happened here? I had 100% toxicity in the toxicity reports, but I only had a 90% accuracy in the histology report. Doesn't make sense. You want to know what didn't make sense? Out of those 6, let's go back, I went to the toxicity report, and would you believe every one of these had a 5 level? They were extreme toxic. There wasn't enough biopsy samples to give to both labs. I can't send Dr. Bocaux in empty bottle. So we clipped the bone next to it. The human body is amazing. It turned around and tried to protect itself by walling off the section. So this is what's called the false positive things. And so this was past extraction sites, this was root canals, and these were avital teeth. Average toxicity, pretty high for avital teeth. Past extraction sites were the worst, even worse than root canals. So we're not going to go in the running machine because I can't get the sound going. Okay, we're almost there, folks. It's case study time. These are fun. Joe comes in, 57-year-old white male, complaint, severe arthritis of his right hand. How many people get arthritis of a hand? Started 3 years before, seen 24 physicians, most of them specializing in arthritis. He's been placed on multiple drugs, which he took himself off of due to the side effects. Side effects are just undesirable effects. They're real. And he was referred by a homeopathic physician, Bruce Shelton. That's what it looked like. This is what he had. 4 amalgam restorations, 5 metal base crowns, 2 root canal teeth, missing teeth, 1 titanium implant, and a partridge juniper tree. And then we had, look at this guy. Excellent, excellent perio. 4 little 4s. My good, or 3 little 4s. That's what he looked like. Now, I don't know. Can you see this? Because, okay. So you can see titanium, root canal, root canal. You can't see too well in here, that aspect. Up here, it's much better on the computer. But here, it's a cavitat. Missing tooth, root canal, I believe. Let's go back. Yeah, root canal. Then we have, again, missing tooth, root canal. Titanium implant. Now, wait a minute. Implants are supposed to grow bone, right? Didn't happen, did it? And then you got over here missing tooth. So we go ahead. We can now sit there and correlate between here and here. 6. This is 16, 17, 18. This is the implant, and this is 32. I know this patient forward and backward because this guy was in such pain. So when he came in to me, I went to shake his hand. He wouldn't let me touch his hand. He said, "You touch it, I'm on the floor." I said, "Boy, you must be romantic." He says, "I'll tell you something. It's almost ruined my marriage." It's sad. So phase 1, periodontal care. We want to make sure he didn't have much to do there. Then we removed all the mercury-based fillings, metal-based crowns that were not going to be extracted. And then phase 3, we did the right side, removal of 7, cleaning of 132, and removal of titanium implant. When he was numb, I went into the titanium implant, went like this with my fingers and unscrewed it. That's how loose it was. The only reason that nobody was able to move it was that it was below the tissue line. And when I laid the flap, I was able to grab the healing cap, and it just came right out. Amazing. 15 days later after the surgery, he shook my hand. He says, I'm 95% better. I want to do the other side. Can we do it today? Can we do it today? I said, Joe, I'm booked out 4 months. You know, that SOB went up to the front desk. Somebody canceled 2 days later, and he went there. He says, I'll take the appointment. What is it? And it happened to be the other side surgery that we were going to do, so it fit into the time slot. He says, put somebody else's name in there. I don't want Doc to know I'm showing up in 2 days. He was a real joster. But his wife came up and gave me a big hug for saving everything, and I think she's definitely a saint. Phase 3 was the left side, removal of the NICO. I'm gone. I'm cured. He used the C word. We're not allowed to use cure, are we? Periodontal maintenance, continuing, seeing the homeopathic no more. He wants a new implant. I looked at him, I said, Joe, look at what we've gone through. I mean, here we are. This is where we are now. Everything's nice and clean. He's wearing a flipper, he can't stand it. So what do? I just got into something called zirconium oxide implants. So I wasn't sure if he could handle an implant, so we agreed to do just one. And if you do implants, you do a drill. It looks like it's sitting there, but it's not. It's just the angle because it's the canine. And then we drilled up here. This is the day of placement. This is 6 months later. This is with the crown. Has not had a problem whatsoever. The bone on that is solid. He's fully back to normal life, fully employed, went deer hunting last season, and a year ago, this week, he came in to me, and his wife couldn't get a peanut jar open. And so she handed it to him, and he unscrewed it, and he started laughing. He said, I had to go to my dentist to fix my arthritis so I could do this. That was one of the most rewarding. He drives like 80 miles to get his teeth cleaned. He just told me, I just won't go to another dentist because they can kill you. So case 2, oh boy. I'm writing you to explain my dilemma and health condition in hope that you will be able to help me. 38-year-old, had a root canal that abscessed. After emergency root canal therapy, severe allergic reaction occurred. Another root canal had abscess. All mercury filling teeth started to vibrate. Her metal dental instruments caused her throat to close. Sleep deprivation. Breathing problems began. Unable to work all day. Trouble driving a car. Allergic reaction to all metals. Unable to wear jewelry. Doctor counted. Her physician counted 14 mercury fillings. Order toxicity test for metals. Results elevated mercury levels. Impaired thyroid, adrenals, liver, immune system functions. You think maybe this person was a little upset? Severe reaction to all metals, and she lived in Sedona, Arizona, where metal is all over the place in the ground. Could not use metal utensils, only plastic. She had doctor support. They used laser, NEAT, the allergy elimination protocol, laser therapy, homeopathic. She became sicker. Why? Because she had no way of getting it out of her system. It was releasing and going right back in. Environmental reactions to where she lived, so she was referred to me. This is what she looked like, good perio, but she had, let me go over here first. This is what she looked like. This is what she had. 14 amalgam fillings, apicolectomy on 6, 4 metal crowns, 5 root canals, missing teeth, impacted wisdom tooth. This wisdom tooth was causing her more problems than some of the other stuff. So we went ahead, we did a cavitat. Now on this, these just weren't done. I don't know why my assistant didn't do those, but all the rest are real. And we have you turn them around so you can see them a little better. And so when we go through this, area number 1, area number 1. Doesn't look bad on the x-ray unless you're trained to see those little black spots. Black spots aren't good. These 2 areas are up here. The impacted wisdom tooth, root canal, and then missing tooth, root canal, missing tooth, and back here, I can't remember the numbers. Here's our Clifford test. This is when they used to use yellow paper, so you know it's a long time ago. NS, NS, NS. All metals were just a disaster. Periodontal care, removal of all mercury fillings of teeth that were not going to be extracted, composite resin fillings, temporary crowns. Phase 3 was removal of dead bone and root canal teeth, replaced with a removable partial flippers or dentures. We put her into an OSB. OSB is out of Tacoma, Washington. Dr. Robeson's work. It is a device that has contours to lift your tongue in a certain position, opening up your airway. And I was able to build that into her partials so she could have a benefit of using that during the day. And then periodontal maintenance. The only problem with the OSB is that, and it's really not a problem if you understand it, you sign a contract with them and they have to make it. And they do a great job off the x-rays and everything they ask you to make and impressions. And I could not make the appliance that they make. It is phenomenal. It really is. The problem is dealing with some of the situations with the company. The gentleman's much older and he has problems letting go. But the product is fantastic. This is what she looks like. We have her in partials. This is what she wrote. And this was in that video in Washington, D.C. when we testified. I want to thank you and your staff for helping me return to a much healthier life. With every surgery, starting with mercury removal to the last surgery removing teeth that created severe sinus pain in my teeth and gums, abscesses in my gums that was infecting my body with continuous infections that was not detected visually or by x-ray. I would also like to thank you for providing me with the best technology. Thank you again for the new lease on life. These people are very dear friends of ours today. Yes, ma'am. Of course. We try to get the mercury out, depending on their health situation, as soon as possible. Because once you start doing surgery, they got to be totally healed. Because if they're healing and you're taking mercury out, how am I going to be sure it's not going to wind up in the wound? And amalgam tattoos are tremendously, tremendously toxic. They might just look like a little black spot, but when we did those testings with ALT, it showed to be highly, highly toxic. So mercury is definitely what I try to get out first. Sometimes you can't do that. Sometimes they have an abscess that has to be attended first. So each case is individual, each case is different. Case 3. Oh yeah, well everybody's seen the trip to the dentist. I don't have any sound, so I can't help you with that. This is Jen. I met Jenny on my 61st birthday. She presented with pain lower left jaw. She pointed directly at her root canal tooth. The prior week, she had visited her dentist who informed her that everything was just fine. Jenny proceeded to tell me how her life has been ruined since she got her beautiful veneers on her teeth and had all her dental work done. At that time, she was 39 years old. She was married, one child, college educated, very ill. She worked as a pharmaceutical rep, and she made 6 figures. This lady, when she walked in, her skin used to be just absolutely perfect. She had the perfect smile. He made veneers that were too thick, and she started snoring. Symptoms: low blood pressure, difficulty breathing, allergies, chronic fatigue, fibromyalgia, heart murmur, mitral valve prolapse, fainting spells, frequent headaches, pain in the jaws, sinus problems, problems with past extractions, orthodontic treatment, problems wearing dental devices, jaw pain developed after veneers, heavy snoring, can't sleep in the same room with her husband anymore because she snores too loud, severe back pain, joint pain, headaches. Life-changing materials since she got her teeth fixed by one of the top aesthetic dentists in Phoenix. And this was the root canal that was done. Temporary crown is poor fitting, overfill endodontic material down here, and patient has swelling and abscess of the area, sensitive to bite and pressure. The week before, she was told she was just fine. And this is what it looked like you can see the material down here, and this is all abscess here and there. That was, I mean, it was tough. We took about 6 or 7 pictures of this because it filled up with blood so fast, but that is actually the abscess. Patient calls office crying that evening. Oh, I was late for my birthday party. First time in over a year, she no longer had lower back pain, and she slept the full night. I also cheated. I thinned out her veneers. Amazing. You know, I tell people we don't lack from vitamin plastic or vitamin P. You don't always need a plastic device in your mouth. Anyway, so this is what she looked like when she presented. This is her pano, and she didn't have one root canal until she went to this aesthetic doctor, cosmetic doctor. And then perio wasn't too bad, except up in the upper right. No amalgam restorations, 2 metal-based crowns, 4 root canals, missing wisdom teeth. And her Clifford test, highly reactive to metals. She also had veneer restorations made incorrectly, causing pain. This is her cavitat. Up here, 3rd molar. 3 in a row down here. Right here, there, and then up here, here, and here. So this is the 1st molar and wisdom tooth areas. So this is what we found on 19. We had microscopic diagnosis, acute exacerbation of periapical granuloma, suppurative pulp necrosis of the apical canal, treated tooth, fibrogen sludge. This was the toxicity, this was the DNA, I'm sorry, DNA test on it. Clostridium tenai and Actinobacterium beaumonti. This is a very interesting bug. Found in the mouth, but if it overgrows can cause lung cancer. And this is a problem. Take a look at this neck. When you find people like this, they usually are computer nerds or work at a computer all day, and this is going to induce sleep apnea because their head is straight like this because they're trying to breathe and open up this airway. Thinned out her new veneers. These were causing her problems. Oral systemic balance we placed, and she's doing pretty good. Unfortunately, she's divorced today. She couldn't get it back together, and the husband just couldn't take it. He just couldn't take all the drama, all the pain, and her not being able to get out of bed. This was a woman who was one of the top sales reps in her field, and then she got everything done, including the boobs, and now she has stuff coming out of her skin. She's highly reactive, but she had to be more beautiful. And the patient feels other dentists have caused a great deal of suffering, though she has gotten her marriage back together. Not anymore. They're divorced. And she's been in and out of Mayo Clinic, and she doesn't want to go to Mayo Clinic anymore. She found out that she saw an ENT DDS physician, and as soon as she said who did the dental work, he decided that the work wasn't so substandard she needed a psychiatrist because the guy was his best friend. Yeah. Putting it all together. So, you know, DNA results are nice. They help us out a lot. The problem is people don't know how to utilize it. It's a great test. We find out what you're resistant to. Actinomyces israeli. These are all terrible, terrible microorganisms. And I work with a lot of different people. And it's amazing that the DNA can isolate many different organisms, bacteria, viruses, fungus that never showed up on an agar plate. They're not going to. This is a fingerprint. And Dr. Billings, Rosnell, Price, if you haven't read their work, go back. These guys were in the 1910s, 20s, and 30s. They sacrificed tens of thousands of rabbits. And my son, who's an MD, PhD, the orthopedic surgeon, looked at their stuff, looked at their experiments. He says, Dad, we aren't that good. We couldn't do their stuff today. We don't have the technique, the meticulous technique that these guys did. DNA testing gives us direct evidence between organisms found in cancerous tissues, arthritic sites, and other unexplained disease from the patient's mouth. We had a cancer patient, and the bacteria that was in the cancer was in their mouth. So when I did my first 90 patients, these were the most commonly seen bacteria. And this was kind of funny. I called Hal Huggins up one day. One of my patients called him. And he has a protocol that after surgery, you can't go more than 3 miles. You got to stay the night, everything else. He never used any homeopathy in his stuff, which I think cancels that statement out. But I'm not going to tell Hal. I never would tell Hal he was ever wrong. You don't get anywhere with Hal when you tell him he's wrong. And number two, he's right 99% of the time. So we chose to do things differently. He says, Michael, you've never been to any of my seminars. And this is when the DNA came out. And I said, well, you always seem to have them on the Jewish high holidays. He said, you pick the date. We'll have a seminar. So we did it in Colorado in the middle of August when Phoenix is 120 degrees. Thought I'd get a cool down time. And we went and did this. And I did my first 90 cases, and I went through this. And I got to tell you, there's 109 different bacterium that they were testing. You do 90 people. Some of them had 35 to 45 bacteria, and do this by hand, and then count it up and put it together. And I came to the conference, and I sat there, and we went through everything. Everybody, Stuart Nunley was there, great guy, president of the IOMT. A whole bunch of people were there. Blanche Gruby was there, and we're sitting there, and I'm giving them statistics. I'm telling them, well, this occurred this many times and that many times. And you can see Hal getting upset because nobody else has ever done that, not even the lab. They're set up to do that now. And they came out with a manual that's really cool of all the organisms that they test for. And it's from a paper that was from Switzerland or Sweden that talked about the bacteria that they found. And Hal put a lot into this. This was his baby before he passed. And I went in and I introduced myself as Mike Margolis, a dentist from Mesa, Arizona, and I sat down. And he says, you're not going to get away with it. Mike is the reason we're here today, because he had a patient that had questions, and I answered the patient wrong. For Hal to say something like that must have been crazy. But we sat back and we worked through it, and we were trying to find this. And this is going to be part of our study. We want to get this, and we want to get the histological reports and find out if there's a certain histological condition and what bacteria, virus, fungus may be attached to it. And then get that in peer-reviewed articles and put that nationwide. And so which organisms affect organs? Well, this goes into hearts, nerves, lungs, red blood cells, oral cancer. I could read all these things to you, but I can't pronounce them. And then the other things that happen is, you know, you sit back, you're not going to remember it, but it's going to be on the stick. And if you all have your sticks from the conference, you can come up to me. The 3 lectures that were presented today, I'll be more than happy to download on your stick. And they, you know, oral cancer. I mean, it's there. German oncologist stated dental infections, especially condensing osseoitis. You look at an x-ray and see condensing osseoitis, and he's saying that leads to cancer. You're talking to Robert Dowling. Am I dead, or do I just feel this way? Fred Hughes wrote that book, and one day I called Fred, and I had to leave a message. And I told my staff, if he calls back, disturb me. I got to talk to him. And I get on the phone. I'm all excited to talk to Fred. And he's on the other side. He's all excited to talk to me. Why? I said, I'm not important. I'm just Mike. I just do my thing. And they sent me, I don't know, probably 6 dozen patients, because I'm in that part of the country, after a thermogram. Thermograms are really revealing. And the heat sources in the mouth pinpoint to where the infection is. If a root canal is on the left side of the body, could lead to breast cancer. And they came up with Saving Virginia's Breast, was this follow-up book on this that Fred Hughes wrote. Excellent, you should read them. Immune disease and heavy metals. And you have zinc, cadmium, nickel, increase the activation. And then they start talking about big words that I can't even pronounce anymore. the sustained activation transcript factor, nuclear factor, KB, NF-KB, by metal activated signaling pathways can lead to chronic inflammatory processes and related diseases, including cancer. Now, inflammatory processes. That is what we're eliminating as dentists. That is the key to health. If a person never has inflammation, they will never have a disease. Pretty bold statement. And so we go into high rates of bacterial films and bacteria problems that we have, and then medical biofilms detection. Fry Laboratories, I helped them set up their tests for teeth, but they were so expensive I couldn't afford it. But they do a different type of DNA testing. They do it through refractory system where they put light in and then they pick up the DNA footprint. So first they ignore you, then they ridicule you, then they fight you, then you win. Mahatma Gandhi. Kind of reminds me of truth. Though this publication mocks the early theory of focal infection and states that a more scientific approach must be undertaken, the authors of this publication time and time again proved that it became clear. In fact, there were situations in which oral bacteria could affect distant structures, in particular a case of endocarditis in susceptible people. Other systemic conditions related to mouth, and the author writes, coronary heart disease, preterm birth, low birth weight, bacterial pneumonia, diabetes, gastric ulcers, H. pylori. DNA testing, if utilized properly, will show the connection between degenerative diseases and oral health. That's focal infection theory. And yet they knocked it in the entire publication, and all they did was describe it. I want to thank these wonderful people who are sitting amongst us today. I couldn't have done it without you. My voice is about shot. I compliment the excellent presentations by Joan and Marianne, because I look at it in a different way, the politics a lot and everything else. I am married to an attorney. You look at it, and you guys do such a great job on the clinical. And in the future, I'm going to, Vance, I want to thank you. I'm going to improve those slides and replace them with what we're doing today, because our surgical techniques are so much better. If any of you ever want to come to my office, all you got to do is call. Weekly, I'm doing these. There might be a nominal charge because of the things that we prepare for you, but if it's too expensive, you tell me. I don't care. This information is for everybody. We have to share it to the world, and that's what both the IOMT and IABDM do. We share ideas and knowledge, and you become friends. I have lifetime friends here that if somebody called me and said, I need your help, I would drop everything and go. And it bothers my wife once in a while, but that's just life. You meet people, special people. I mean, look at this. We got Farah, Kim sitting over here helping us today because of the goodness of their hearts. They want everybody to succeed, as we want to see everybody else succeed. I can't even say your organization, because your organization I've been a member of over 22 years. Excellent, excellent groups. We just need to cooperate better and share our knowledge together and support one another. Thank you so much for today.